Hello and welcome to another NTN Morning Update. My name is Jessie Leonce. I'm joined in studio as usual by my colleague Carlton Cyril. Today is Friday, the 24th of July 2020. Thank God it's Friday, TGIF. We're barreling into the weekend, and so is a tropical storm, Gonzalo. We have the updates to that coming up for the duration of this program. We will be speaking to Meteorologist Andre Joyeux later on in the program. We will also be speaking to someone from the Ministry of Health and Wellness. I believe it is Dr. Michel Francois, the National Epidemiologist. We got word yesterday of Saint Lucia recording its 24th case of coronavirus. We also did get word that a Saint Lucia national tested positive for COVID-19 upon arriving in St. Vincent and the Grenadines on Sunday, July 19th. So we will be getting the details to that in terms of contact tracing efforts and whatnot from her over the phone in just a minute. And of course, we have some other updates from the morning from the government of St. Lucia for the morning. We have a check handover ceremony at about 9 o'clock this morning, and that is going toward the NCF. Again, the efforts toward fighting COVID-19 continue. We are still on alert for the coronavirus. St. Lucia is still under a state of emergency, poised and ready and braced to take whatever measures necessary, full lockdown, going back into curfew, whatever measures necessary to keep COVID-19 at bay, to contain it and keep it at bay. At present, we have all our sectors reopened. We are in phase 5 of our reopening in wake of COVID-19, and we do hope everybody is playing their part, wearing of the masks, observing the 6-foot distance when you are going out in public or you're going into establishments and whatnot. And we do hope you are playing your part. We are still being vigilant. We're still on alert for COVID-19. Good morning, Carlton. Are you still on alert?
Oh yes, as always, and ready to go. Bon, moi dis bonjour et merci encore. Nous ka di merci pour vous qui ka suivre nous. Avec nous ici à Sainte-Camadlan, qu'on nous ka ba information et puis développement. Nous ka prendre moment ça pour dire bonjour et merci pour ces gens Facebook nous, ces gens qui suivent nous à sur radio, qui écouter ben yon manière ben l'autre ka tande voir nous ici, nous ka di merci qu'on l'a écouté, nous ka ba développement avec information à sou en vendredi bon matin, le 24 juillet quand parmi bagay ou ka tande jodia ni pour faire plus mauvais temps Gonzalo nous avons parlé avec monsieur Joyeux qui est toi département qui est responsable pour temps ici l'autre développement là vini pour nous ni un l'autre monde 24 ça qu'a fait un l'autre monde qui est testé positif là vini pour vermin corona et puis nous avons docteur François qui a parlé à sous yo département qui a visité côté tout ce monde ça a passé mettez bagaille en weg à parmi développement qui a venu dans un moment où était en écouter puis nous Sainte-Camadlan côté nous avons information là pour faire ça qui a passé cette lycée non moi c'est Carlton Cook Cyril car monsieur hôtel mais cadeau où était en écoute.
Thank you for that, Carlton. St. Lucia records its 24th case of COVID-19, but not to worry, the Ministry of Health, the health officials have it all dealt with. So stay tuned for the details to that, as well as Tropical Storm Gonzalo. We get an update from Andre Joyeux from the Meteorology office. So stay tuned for that and more coming up after this break.
Overnight, growing national unrest.
Society, a digital cashless society, one world currency.
A vaccine for COVID-19.
Drop
the COVID virus.
Macy's iconic flagship
Virus. Track the coronavirus.
Everybody vaccinated.
On the corona pandemic.
The opposition to the lockdown.
An infected
Conspiracy theories
about the coronavirus.
Bizarre claims.
Truth about the origin of COVID-19 hidden from the rest of the world. And the Chinese.
In this constantly changing environment, resulting in sensory overload, cut through the noise and tune in to the National Television Network, the official source of information, all facts.
Thank you so much for staying tuned. If you are just joining us, a special good morning to you watching us on air, online, residents in Saint Lucia, Saint Lucians in the diaspora. A special good morning to you. Saint Lucia is under a tropical storm warning. It has been issued for our island, and we have the details coming up for that in just a moment. In the meantime, Saint Lucia records case number 24 of COVID-19, and just as Parliament was wrapping up to go into lunch yesterday afternoon, we got word from the Ministry of Health and Wellness of this 24th case. I now go to the statement that was prepared from the Ministry of Health and Wellness on this latest development.
On Thursday, July 22, 2020, the Ezra Long Laboratory of the OKEU Hospital reported that from a batch of 60 tests conducted, there was one positive case of COVID-19. The individual is a 59-year-old female who arrived in Saint Lucia on July 10, 2020. Upon return to Saint Lucia, she was placed in institutional quarantine and was tested 7 days later as per quarantine protocol. Upon receipt of the results, the individual has been transferred to the respiratory hospital for isolation and related supportive care. She's currently doing well. The Ministry of Health was informed by the St. Vincent's Health Ministry of a St. Lucia national who traveled to St. Vincent and the Grenadines on Sunday, July 19, 2020, and after screening, tested positive for COVID-19. Currently, we are investigating the matter and in the process of undertaking contact tracing for this individual. The Ministry of Health, we once again reiterate the importance of quarantine for returning nationals and visitors, as it is a great measure in minimizing the risk of transmitting COVID-19. It is with this we ask that people adhere to the 14-day quarantine time, and for those who are in home quarantine to stay there for the full period of time. This action is expected to protect the health and safety of every individual within our country. So we appeal to everyone to continue supporting our national efforts to minimize the threat of COVID-19 on our island. We will continue to advise on the importance of maintaining the standard recommendations for infection prevention and control. We also ask the public, as we enter into the highest phase of reopening, we ask persons to ensure that they use their mask and also they adhere to the measures of physical distancing. We never know when we can get a case and need to do the tracing. With those measures, we reduce any chance of the transmission of COVID-19. The Ministry of Health, we will continue providing regular updates on COVID-19.
An update there from Dr. Sharon Belmont-George giving us the latest development and news on the 24th case that has emerged of coronavirus here on island. It is a 59-year-old female who arrived in St. Lucia on the 10th of July 2020, and upon return to St. Lucia she was placed in institutional quarantine, thank the heavens, and was tested 7 days later as per quarantine protocol. Upon receipt of the results, the individual has been transferred to the respiratory hospital for isolation and related supportive care. She is currently doing well. And the Ministry of Health, as indicated here, the Ministry of Health was also informed by the St. Vincent and the Grenadines Health Ministry of a St. Lucia national who traveled to St. Vincent and the Grenadines on Sunday, July 19th, 2020, and after screening was tested positive for COVID-19. We will be hearing from another official on this case and what efforts are underway. The investigation into this reported case in St. Vincent of a St. Lucia national having coronavirus. But in the meantime, you know, Carlton, this latest case again is another testimonial to the strength and the safety net that is institutional quarantine.
Definitely, just we could see it working, and if I'm correct, that would be our last 4 or 5 cases as a matter of what has been put in place. We have been able to catch, for lack of a better term, the virus before we could see any community spreading per se. And of course, it re-emphasized the importance of persons following the protocol of the mask, the hand sanitizing, the social distancing. And now we have opened the borders. Of course, we are saying persons need to adhere to the 14 days mandatory quarantine, whether it's at home. And when we are at home and we speak at home, we say we the public have our role to play as it relates to making sure, and those numbers are there. And we heard again from the CMO, from the police department, and from those different agencies are saying, if you see something, say something. If you know of something, say something, bring it, because just here again we could see how vulnerable we are as it relates. Just imagine if we didn't have those safety systems in place. So kudos to the command center as it relates to the national protocols, and of course to Saint Lucians following them.
Absolutely. And we now move on to the investigations into the reported COVID-19 case. We did get word initially from CMO that the ministry was also informed by St. Vincent and the Grenadines Ministry of Health and Wellness of a Saint Lucia national who traveled to that country on Sunday, July 19th, and after screening was tested positive for COVID-19. We now go to a statement coming from the Department of Health and Wellness here in Saint Lucia, speaking on the ongoing investigation into this reported case of a national contracting coronavirus and traveling abroad.
The Department of Health and Wellness has received information concerning a positive case of COVID-19 detected in St. Vincent and the Grenadines. The individual in question is a Saint Lucia national who traveled to St. Vincent and the Grenadines and was screened and tested as per the island's national protocols. On July 21, 2020, the sample was tested at the Caribbean Public Health Agency and results of the PCR test was confirmed for COVID-19. The Department of Health and Wellness has since deployed a team to conduct investigations both at the home and at the workplace of the individual. The team from the Department of Health is currently doing the necessary contact tracing and investigations in order to determine the source of the infection as well as the level of exposure of contacts in order to interrupt the chain of transmission. The team consists of officers from the Epidemiology Unit, the Infectious Diseases Unit, Community Nursing, Bureau of Health Education, and Environmental Health. We operate from a holistic approach, ensuring that not just screening and contact tracing is done, but also thorough inspection of the surroundings and adherence to protocols. All staff members will be screened and tested as deemed necessary by the team. Staff will also receive guidance from the team on home quarantine and how to protect themselves and their families. Discussions are ongoing with the management of the establishment, and guidance has been issued to ensure that staff remain quarantined until completion of this mandatory quarantine period. Guidance on infection prevention and control will also be re-emphasized. The Department of Health and Wellness takes this opportunity to remind persons of the need to adhere to the protocols for home quarantine. We continue to receive reports of violations of home quarantine. These protocols have been put in place to protect the public, especially our most vulnerable. We appeal to persons to be more responsible and to comply with the guidelines and the protocols that they have agreed to. Persons are encouraged to ensure the use of a face mask when in public, along with maintaining the 6 feet distance. Cover your mouth and nose with disposable tissue when coughing and sneezing, and also ensure regular hand washing with soap and water or an alcohol-based hand sanitizer where soap and water is not available. The Department of Health and Wellness will continue to provide regular updates on COVID-19.
That was Dr. Michelle Francois. She's the National Epidemiologist, giving us an update on investigations, a probe that has been initiated into the reported COVID-19 case of a Saint Lucia national who traveled to St. Vincent and was tested positive there. We're getting word from the Department of Health and Wellness here on island that upon receiving a word from St. Vincent and the Grenadines' Ministry of Health that they have so far deployed a team to conduct investigations conditions both at the home and the workplace of that individual. The team from the Department of Health is currently doing the necessary contact tracing and investigations in order to determine the source of the infection as well as the level of exposure of the contacts in order to interrupt the chain of transmission. We haven't had a case of a community case in a while, and so fingers crossed that it does not pan out to be that. We so far have been getting cases, imported cases, persons flying in, returning home, returning nationals, tourists coming into Saint Lucia. We're getting some cases from the incoming flights that we've been having, but no indication of community cases recently.
Right. Rightly so. Je sais qu'on nous va continuer par une nouvelle bon matin. Nous avons une nouvelle qui yon moun ja testé positif et ça a mené pour 24 moun qui a testé positif avec corona Saint Lucia. Moun madame 59 ans et puis il vit Saint Lucia le 10 juillet et puis là il tourne Saint Lucia parmi protocole supposé suivre c'est pour lui prendre test 7 jours après il prend test ça résultat avié et puis pour la peine yo testé positif et puis yo voit à présent il en l'hôpital à isolation ça c'est vieux côté au cas point moun qui a trouvé quoi yo testé positif et puis là il a point si pour yo bay traitement et brisé qui dit il a fait bien tout bonnement. En l'autre nouvelle, nous attendons un jeune Jean Hod Saint Lucia. Il allait voyager Saint-Vincent dimanche, le 19. Et puis là, il y a un protocole Saint-Vincent, il y a un testé positif. Et à présent, le ministère a fait investigation ici. Encore, le ministère a dit qu'il est venu pour quarantine, expressément pour les gens qui vivent en Saint-Lucie. Et puis, les gens qui ont visité nous, il a dit que les gens pour prendre précaution tellement. Il y a un séparat qui est bien important, c'est les gens pour changer ou ni pour quarantine. 14 jours expressement yo ka parler 10 moun qui ka fait kayo nous ka ouais à présent raison nécessité pour moun quarantine là yo dit quarantine comme on te dit avant sous connaître un moun qui pas ka suivre quarantine ka casser protocole là un moun qui retourner qui c'est femme qui c'est gens nous ka ouais dommage là qui ça fait ou apporter pour les autorités et pour la peine investigation qui a continué là il vient pour moun ça qui voyager aller Saint-Vincent et puis là nous tenons au département Epidemiologist et puis là ça c'est docteur Francois il a dit les yo hen test lavier Hard CAFRA, c'est Caribbean Public Health Agency, résultat conformé Mounsa testé positif. Et bien là, il a dit, là, venu pour situation ça, département qui est responsable pour santé, il n'a jamais été en compagnie moun ensemble pour faire investigation. Là, il venu pour côté Mounsa qui a été côté ITK travail. Parmi moun qui a sous team ça qui a fait investigation ça pour déterminer côté moun ça trouvé quoi affecté qui quand moun il vient contacter et puis il dit ça c'est un bagage qui bien important yo kay fait ça pour suivre transmission ben ou kay ça va sous team ça l'année officier hod office Epidemiology l'année moun hod office qui responsable pour disease infection là il vient pour nos communes l'année officier hod ça et puis bureau de santé pour éducation et puis environnement là il a dit yo ka oppoé et puis yo ka avait toute bagaille là il vient pour faire assurer yo en détail aller et passer tout partout moun sa peut-être téhaillé et ben vini en contacter et puis moun expressément là il vient pour protocole tout membre qui était à travail et ben qui était en contact avec moun sa yo déjà yo kay trouvé ko yo quarantine qui a dit yo ka bay c'est moun ki a fait investigation yo JID les vini pour ça. Avec discussion qui aller aussi avec management place là avec établissement côté ITK travail et puis comment bien dit c'est travail là yo kay wete quarantine juste yo fini quarantine qui c'est 14 jours ou supposé ni département santé qu'a point opportunité ça encore pour 10 moun souple les vini pour protocole et puis quarantine la kay point soyez souple là yo ka di yo ka hen chay rapport di moun pas ka quarantine là yo supposé kayo yo di yo mettez ces protocoles en place parce que ça c'est pour protéger public là expressement moun qui pli vulnérable parmi nous encore kouya ka aller pour moun point responsabilité ça les vini pour JID avec protocole et yo ka courage ou souple pas oublier masque distance sociale parmi l'autre bagaille pour laver les mains là ka estionner avec là ka tous ces feuilles en coup de bois ou bien sous une serviette qui ou ça été après encore souple nous ka plaider pour souple encore les vini pour protocole suivre les expressement pour ces moun qui ka retourner ici changer encore nous ici à espérer nous ka attendre monsieur Joyeux c'est lui qui est responsable les vini pour mettre office Saint Lucia ça c'est département qui est responsable pour ban nous nouvelle à sous-temps nous ka parler dans un moment parmi l'autre bagaille aussi attendre docteur Francois Hod office Epidemiologist là et puis nous ka do retenir écoute plus développement ici à Saint-Camadlan pour nous avoir information et puis développement. Merci tellement.
Thanks for that, Carlton. Saint Lucia has been placed under a tropical storm warning. It has been issued for the island and it took effect at 5 a.m. today. We get the details to that coming up after this break. We have Dr. Michelle Francois, the National Epidemiologist. She will be calling later on this morning to give us some more information on the investigation that has been initiated due to this case that we're hearing, St. Lucian having contracted COVID-19 and testing positive for COVID-19 in St. Vincent and the Grenadines. And we will also be hearing from the director of the Met Services, Mr. Andre Joyeux. He will be speaking to us on the tropical storm warning that has been issued for the island. So stay tuned for that and more coming up in just a moment.
Virus ready to harm us. Panic is not the answer. We can win this together.
Often use hand sanitizer. Better yet, use soap and water.
We must protect each other if we are to beat this corona.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging are up. No, no.
Advice is you to please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Saint Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
She's been watching, waiting, wondering when the sands of time will give way to a tide of change, and for yesterday and today to become a new tomorrow. For a time when her sun can kiss the cheeks of your loved one and her stars can twinkle in her honeymoon skies. When her earthly embrace will reassure and calm your soul. And her unique view can change your whole perspective. Proudly, she has risen to meet new challenges and to provide safe harbor to all who reach her shores. For her hopes and dreams still stand, shoulder to shoulder, a precious reminder of experiences yet to come. So, Wherever your moments and memories take you, let her sense of adventure set you free. She is Saint Lucia. Let her inspire you.
Do you have a question for a government minister or ministry? Here's your chance to ask anything. Send in your questions as videos or text to askmeanythingntn@gmail.com, and we will have your questions answered live on NTN Channel 122. Follow us on Facebook and YouTube for more updates and your chance to ask anything.
Thank you so much for staying tuned. This is the NTN Morning Update coming to you live from the GIS Studios, the Information Command Center. Today, in addition to COVID-19 news, we have leading a tropical storm warning has been issued for Saint Lucia, and we understand that it took effect at 5 a.m. this morning. Tropical storm warning means that the tropical storm conditions are expected within the warning area within 36 hours. At 5 a.m. today, the center of Tropical Storm Gonzalo was located near latitude 10.0 degrees north, longitude 51.8 degrees west, or about 670 miles or 1,000 kilometers east-southeast of Saint Lucia. Maximum sustained winds are near 60 miles per hour. Some strengthening is forecast during the next day or two, and there is still a chance that Gonzalo could become a hurricane before reaching the Windward Islands. Tropical Storm Gonzalo is moving towards the west at 14 miles per hour or 22 kilometers per hour, a westward to west-northwestward motion with an increase in forward speed is expected through the weekend. On this track, the center of Gonzalo is expected to pass near St. Lucia on Saturday. A tropical storm warning is in effect for St. Lucia, for St. Vincent and the Grenadines, and Barbados. A hurricane watch is in effect for Barbados and St. Vincent and the Grenadines. And hurricane watch, as indicated, a tropical storm watch is in effect for Tobago and Grenada and its dependencies, that is Petite Martinique and so on. Swells generated by Tropical Storm Gonzalo will begin affecting portions of the Lesser Antilles by later tonight. Small craft operators around St. Lucia are asked to exercise caution when venturing far from port. And we do hope that you're taking all the necessary precautions, especially at this time. We are in the Atlantic hurricane season, so this should come as no surprise to the population. Making sure you fortify your homes, you put your documents in double plastic, and having your dry foods on standby for any eventuality. We will be hearing from the director of the Saint Lucia Meteorological Services. That is Mr. Andre Joyeux. He will be speaking to us over the phone in just a moment. We will also be speaking to Dr. Michelle Francois over the phone. She's the national epidemiologist, and coming off of this 24th case of the coronavirus that we have recorded here on island, registered here in the country. She will be giving us an update to that effect, and also giving us an update on the investigation that has been initiated due to word from St. Vincent and the Grenadines that St. Lucia national arrived in that country and tested positive for COVID-19. We're getting word from the Department of Health and Wellness that a team has been deployed to conduct investigations both at the home and the workplace of the individual who just traveled to St. Vincent, testing positive for COVID. And the team from the Department of Health is currently doing the necessary contact tracing and other investigations in order to determine the source of the infection, as well as the level of exposure of contacts in order to interrupt the chain of transmission. So work continues, efforts are feverish to fight COVID-19, any possibility of it existing in our neck of the woods, and we do hope again you're playing your part. Carlton?
Merci tellement, Jess. Quand nous allons continuer avec une nouvelle ici à Sainte-Camadlan, information là pour faire et puis Gonzalo, là où ils savent là vini pour dernière location 5h bon matin, là nous ten Gonzalo trouvé quoi 10 degrés nord ça c'est latitude, et puis longitude 51,8 degrés, là il vient pour side soleil couchant. Et bien à peu près 670 liés, hors c'est type en 1000 km. Pli sud, souvle di sud soleil, façade soleil levant, hors Saint Lucia. À présent, il y a vent qui a fait à peu près 60 lieues par nez du temps, 95 km par nez du temps. Là, il a dit qu'il a venu plus fort en yon, et puis 2 jours pour venir. Et puis là, on a chance Gonzalo qui fait un hurricane si il arrive à ce pays où il devant. Là, il a dit qu'il est venu pour Tropical Storm Gonzalo. Il a descendu à 14 lieues par nez du temps, 22 km. Par nez du temps, là en façade soleil couchant, et puis motion et descend dans là, il a dit qu'il ni pli quoi qui expecté pour arriver nous par week-end. S'il continue comme il a passé pour Saint Lucia bon samedi. Là il venu pour ça, il a dit un avertissement à mettre dehors pour Saint Lucia, Saint-Vincent. Et puis, c'est Grenadines là, Babad. Là aussi, il y a Yondor by Babad, Saint-Vincent et puis Grenadines là. Et puis, ça aussi pour Tobago et puis ces petits pays qui vont là et puis Grenada. As a result de ça, nous avons dit, là, il vient pour l'âme, nous avons commencé à la marée à monter et ça a commencé à affecter ces petits pays et l'île Antilles là, bon, Oswea. Et puis, il y a des qui sont petits bateaux, ou qui ont servi là, mais souple, il y a des pour prendre précaution, expressément sur ou qui sorti dehors là. Office Saint Lucia qui est responsable pour temps Meteorological là, il a continué pour changer yo, et pour Gonzalo qu'a fait, et il a un autre statement à peu près 8h bon matin. Quand tous ces corps informés, là venu pour Gonzalo, mais c'est mettez bagaille en place comme j'ai bien dit, c'est pas à présent on est supposé qu'a fait ça, changer depuis saison commencé, on est supposé qu'a fait ça en miette. Nous pas dans situation encore côté tout le monde a comblé en ces supermarkets là, tout le monde a une petite boutique changer, nous ni Covid. Et encore, mais ça pas qu'à faire bagaille la pli, mais il dit, là où on a des plus de chiens à l'eau, mais nous avons quoi que nous avons dit bagaille passé ça. Pas oublier qu'à venir plus tard, nous avons parlé de mon office, Met office là qui est responsable pour Saint Lucia, M. Joyeux, c'est lui qui est responsable pour office là. Et nous avons aussi une nouvelle docteur Francois. Ça c'est l'avenir pour car nous y a moun qui voyager aller Saint-Vincent là quitter Saint Lucia qui a nous plus nouvelle l'avenir pour ça. Et plus tard aussi nous avons une institution qui est responsable pour les affaires chartered accountant yokai ici pour faire une présentation qui a changé l'avenir pour faire téléphone nous ni moun qui a fait donation yo toujours yo ka bay donation quoi nous ka un chèque à présenter dans un moment. Tout ça avec le développement, où était puis nous ici à Sainte-Camadela. Merci, Jesse.
Thanks for that. And we do have Mr. Andre Joyeux, the Director of Met Services, going to call this morning. Dr. Francois from the Department of Health and Wellness to call as well to give us updates on the obvious, the tropical storm warning, as well as the investigations into the reported COVID-19 case. And we do have, coming up in the broadcast today, the Institute of Chartered Accountants will be making a presentation to the telethon committee, and we know that the organizations, entities, business, and otherwise have been flooding in, bringing in their showing their support by making their contributions in cash and in kind towards the COVID-19 fight. And so this is just another one of them, the Institute of Chartered Accountants, to make their presentation to the telethon committee this morning. We already have the presentation set prepared for their arrival and the presentation. This morning, we have a press release coming from the Ministry of Education, Innovation, Gender Relations and Sustainable Development on the waiver of import duties for alternatives to single-use plastic. And we did hear of this earlier in the sittings of Parliament earlier this week. And just to read from the press release so you get a greater understanding of what is happening in this case. The government of Saint Lucia has approved the waiver of 100% import duties on all biodegradable, plant-based and compostable food service containers entering the local market. This is in support of the Styrofoam and Plastic Food Service Containers Prohibition Act number 22 of 2019, enacted August 1st of 2019. The act prohibits the importation of all styrofoam and selected single-use plastic food service containers. This waiver is necessary due to the high price of the alternatives, which continue to be a major deterrent to businesses, and the resultant effect is the increased charge to the final consumer. Some businesses have had to increase their prices in order to cushion the high expense of the alternatives to styrofoam and plastics food service containers prohibited under the Act. And therefore, this long-awaited concession should be welcomed reprieve for consumers and suppliers to address their challenges, as they have been supportive from the onset of this initiative. Honorable Dr. Gail T.C. Rigobert, we know she has been championing this cause, it being her portfolio ministry. In reiterating government's continued support and commitment, declares, as we continue to listen, that's quote, we heard a further cry as a result of this initiative. It is no secret that the cost of suitable alternatives to the banned items is a concerning issue to all, from the importers to the consumers and patrons of the various establishments and businesses. We want to assure the public that we are equally concerned about protecting the environment and safeguarding livelihoods. In order to ensure that the new biodegradable and compostable food service containers being introduced on the local market are of the highest quality, meet international standards, and are suitable for use in the food and beverage industry of Saint Lucia, the Department of Sustainable Development will work alongside the Saint Lucia Bureau of Standards in providing approval for the concessions. Minister Rigobert also encourages persons to adhere to the procedures in obtaining the concessions to ensure the standards of the food service containers presented on the market are of the best quality. For more information, you can contact the Department of Sustainable Development at telephone number 468-5861 or 468-5863 or 468-5810. So that is the word coming from the Ministry of Education, Innovation, Gender Relations and Sustainable Development on the waiver of import duties for alternatives to single-use plastic. We're seeing coming out of the move by this administration to ban, to eliminate single-use plastic items, that, you know, there is a concern that the alternatives may be a bit pricey. And the government of Saint Lucia has responded in kind to this by waiving the import duties for alternative food service containers. So please take note of that.
Oui, Jesse, là ka continue about information pour ça là pour faire puis c'est container plastique et puis styrofoam nan ou kay bien savent ba ak là là vini pour ak vende limo vende de l'année 2019 passé le 1er août. Ça c'est l'année passée, là il vient pour moun ka servi styrofoam et puis plastique, c'est contenant ça pour vendre manger et puis l'autre bagay yo pas ka permettre ça. Pour raison ça qui a fait là en chayan c'est l'autre contenant yo ka servi à présent, yo dit qui pli mais pour moun servi c'est bagay ça yo ka pourri si yo vivant glo et ben les moun jeter n'importe côté. À présent ça qui fait là, là il vient pour le gouvernement qui a dit à présent, il a permis ces gens ça pour mener l'autre contenant tué et puis il pas qu'à pour payer à souyo, là il mener customs, il pas qu'à pour payer quand l'argent à souyo. Quoi raison pour ça, c'est parce que il déjà ton en chaque place business qui a dit il a coûté yo pli, il plus cher et puis pour la peine il a passé puis ça à sous customer quand là président gouvernement a dit les c'est gens business à mener et ben monde qui a mené c'est plastique pas c'est plastique là c'est l'autre container qui a pourri qui est plus bon pour environnement là yo mené ça yo ka une concession à sous encore là il vient pour honorable Dr. Gail Rigobert il vient dit gouvernement là est katan moun et puis il comité pour lui faire assurer yo tant ça moun ka dia et puis pour assister yo pour raison ça yo ja prend décision ça pour buy concession en laisser container qui primaire pour environnement yo nan se bay lan yo dit ministère aller plus loin pour dire yo ka encourager moun souple l'année bagay qui jamais été en place ou ni pour suivre pour une concession qu'on a fait assurer ou suivre c'est bay ça qui a mis en place pour ça une concession. Pour plus d'informations, il y a beaucoup de départements qui sont responsables pour le développement sustainable. L'IMOA 468-5861, eh bien, ça c'est 468-5861, eh bien, 468-5863, eh bien, 468-5810. Vous pouvez créer n'importe quel numéro, ça, si vous voulez plus d'informations, ou ça aller dans les pages gouvernement Facebook, et puis là, vous avez une information ça en bas, sujet, là, il vient pour concession, en laisser conteneur 9 ans. Changer, nous là, espérer, nous allons parler de M. Joyeux, là, il pour faire mauvais temps qui va venir, il va nous plus d'informations. Aussi, nous allons espérer docteur Francois, qui va nous plus d'informations, là, il pour faire contact tracing, il va nous une explanation à ce dernier monde qui voyageait à les services là, et puis il trouve qu'il testé positif. Parmi l'autre bagage en donation, là il vient pour téléphone, nous avons ça institution qui est responsable pour accountant en Saint Lucia.
Thanks for that, Carlton. And we continue with the Parliament news. The Prime Minister, the Honorable Alan Shasney, moves a motion and it's approved to borrow US $10.7 million US dollars for COVID-19 financing needs. And just reading from the press release coming from the Office of the Prime Minister, the government of Saint Lucia continues to balance the needs of the country and the financing for essential COVID-19 pandemic-related health emergencies and economic and social recovery. Prime Minister and Minister for Finance, Honorable Alan Shasney, moved a motion in Parliament on Tuesday, the 21st of July, to borrow the sum of US $10.7 million from the Caribbean Development Bank, that is CDB, for this purpose. And the CDB is a key development partner of Saint Lucia and continues to provide critical support in the government of Saint Lucia to the government of Saint Lucia in periods of distress. The COVID-19 pandemic, in one such event as this global pandemic, has caused unprecedented distress to individuals, businesses and economies locally, regionally and globally, internationally. According to the Prime Minister, the pressures on the operations of central government remain and is now compounded with the obligations to respond to the ongoing pandemic. Daily tough decisions are made to prioritize initiatives, protect the nation and sustain economic and social activity. This loan will permit the government to preserve fiscal space and allow for the financial resources that would have been required for debt servicing to be directed to financing the immediate needs of the country in responding to the coronavirus pandemic and resuscitating the economy. The Prime Minister explained to Parliament the specifics of the loan and responded to concerns from the opposition as well. So we do encourage you, if you have not yet had a chance or you did not sit through this week's Parliament, to go back and take a listen to the Prime Minister's delivery in addressing concerns of the opposition and by extension the population at large, and explaining the specifics of this CDB loan. So that is a second Parliament update coming to you at this point. We have some bulletin information for you before we take a quick break to begin our calls. Our call from Dr. Michelle Francois from the Ministry of Health and Wellness. She's the National Epidemiologist, speaking to us on the 24th case of COVID-19 that was registered yesterday, as well as the investigation that has been initiated into this case of COVID-19 of a St. Lucian national traveling to SVG, St. Vincent, and testing positive there. So efforts are underway to find out if indeed that person contracted COVID-19 while they were in St. Lucia. And a team has been deployed to that person's workplace and that person's community, their home, to find out the extent of the effect of that case. Some bulletin information, a consultation to be held for farmers producing or interested in producing hot peppers. We've heard from Export Saint Lucia. They will be hosting a consultation for farmers producing or interested in producing hot peppers. The consultation will take place on Wednesday, July 29th, that's next week, at Export Saint Lucia's office at Uranora House, Point Seraphin, Castries. Kindly confirm your interest with Mr. Josen Badal via the email address at jbadal@exportstlucia.org or call 468-2145. We are on standby, NTN Morning Update on standby for word from the St. Lucia Met Services and the Ministry of Health and Wellness. They should be calling in just a moment during this broadcast to give us an update. We know we are under tropical storm warning for Gonzalo, and that took effect at 5 a.m. this morning. We also looking to hear some information, get an update on the investigation that is underway on this case that of a St. Lucia national who contracted COVID-19 upon having tested positive for COVID-19 in St. Vincent and the Grenadines. So we want to find out what's the extent of that case, if indeed that person contracted COVID-19 while in St. Lucia. So stay tuned for that coming up after this break. We also have a special presentation for you. The Institute of Chartered Accountants will be making a presentation to the NCF, and that is again toward the COVID-19 fight here on Island. Stay tuned.
My angels in disguise.
working on the front line. My angels in disguise. Thanks for working on the front line. You bring tears of joy to my eyes. Thanks for working on the front line. You bring us home. Thanks for working on the front line. Don't know how you cope. Thanks for working on the front line. My angels in disguise.
And in the latest news, the coronavirus, or COVID-19, continues to be a health emergency across the world. Caribbean people are concerned.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. And don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening. We're in this together. We all got to work with each other. Look out for our friends and our neighbor. And if you feel sick, don't be afraid to call the doctor.
Red Cross volunteers from across the Caribbean, working hard to fight discrimination. So if a person should feel ill, then they will contact the authorities without hesitation.
The most vulnerable are the elderly, but the truth is it can infect anybody. So what we need is solidarity. Everyone helping everyone like a family. So
this is a message to the nation. Make sure you seek out the right information from official sources like the Ministry of Health, Red Cross and the World Health Organization.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. And don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening.
People around the world facing this pandemic. Coronavirus have the whole world a panic. Now is not the time to be fearful, but to be careful, supportive and empathetic.
This is the state of the society. Some people full of fear and anxiety. Yo, a lot of fake news in the community. But what we need now is more love and unity. So
this is a message to the nation. Make sure you seek out the right information from official sources like the Ministry of Health, Red Cross and the World Health Organization.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. And don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening. We're in this together. We all got to work with each other. Look out for our friends and our neighbor. And if you feel sick, don't be afraid to call the doctor.
Thank you so much for staying tuned. We're just busy preparing the set for the last finishing touches on the presentation that's supposed to happen in just a moment. The Institute of Chartered Accountants, who will be making a presentation to NCF. At this point in time, we have on the line Dr. Michelle Francois. She's the National Epidemiologist, speaking to us, giving us an update on efforts at this time.
Right.
Oops. Oops, we have a call actually from Mr. Andre Joyeux. Well, we've been telling you that we're expecting 2 calls this morning. And so, of course, Andre Joyeux beat Dr. Francois to the punch. We do have Mr. Joyeux on the line. A special good morning to you, sir, Director of Met Services.
Hi, good morning.
Thank you so much for calling in.
No problem.
Okay. If you could just give us a status update on Tropical Gonzalo and how it will be affecting Saint Lucia this morning.
Okay. At 8 a.m. this morning, Gonzalo was located at 10 degrees north, 52.8 degrees west, which is 600 miles east-southeast of Saint Lucia. The system is moving towards the west, and a west-northwestward track is expected later. It's moving at 15 miles per hour, and the maximum sustained winds right now is at 60 miles per hour, with some strengthening expected later in the day. It is a small system, and the tropical storm force winds extend 25 miles from the center. But on the forecasted track, It's expected to pass between Grenada and St. Vincent, and Saint Lucia is at the edge of that forecast track. So we are under a tropical storm warning because there is a chance that we could be affected by the system. So we're expecting rainfall up to 2 to 3 inches, and we're asking persons to be prepared.
Okay, thank you for that. And if you could just speak to persons perhaps who will be more prone, certain sections of the island perhaps?
Could you repeat that, please?
Could you just speak to perhaps individuals who may be more prone to the effects of Tropical Storm Gonzalo at this point in time? I read the earlier release was that individuals in the south of the island.
Okay, yes. Especially local fishermen, they are asked to remain in port because the seas would be locally rough. In certain areas that are prone to flooding and landslides, with the 2 inches expected, they should take precautions that landslides and flooding could take place.
Okay. Just in general, can you just give us an overview of this year's Atlantic hurricane season? How active is it? And just put things into context for us. What can St. Lucians, individuals in our side of the world, expect for this hurricane season beyond Tropical Storm Gonzalo?
Okay. The season started with the prediction that it would be very active, between 13 to 19 named storms and 6 to 10 hurricanes, 3 to 6 of which would be major hurricanes. So from May, which they started off kind of early, we had 2 named storms. We had 2 in June, and right now in July we have 4. So as we speak, it's not only Gonzalo that's in the area, but there is Tropical Storm Hana in the Gulf of Mexico. And so we are going into a period where we expect further, more hurricanes to affect the Eastern Caribbean.
Okay. And can you give us perhaps from your office an update on water levels, because we are still under a water-related emergency. If you could just give us an update to that effect.
Okay, the water emergency was issued by the Ministry of Agriculture based on very low flows for the entire year, actually starting from last year. So in the wet season last year, we didn't have the expected rainfall, and then we had the exceptionally dry season. So the water emergency was issued, and right now because of the tropical waves and hopefully Gonzalo, we should be on track to get the water levels back up and for us to discontinue the water emergency.
Okay. Thank you very much. I'm just going to hand you over to Carlton for a minute.
Mr. Joyeux, let me say good morning and thanks for having us. Cook say, I do not know how good is your Creole. Should I engage you in Creole or English? We'll do the English. We'll do the English. Okay, I get the just for those of us listening and probably viewing this telecast right now, in terms of when we hear tropical storm warning, I mean, and persons might be, a little on the back foot to say it's not a hurricane, or give us, just break it down in terms to let us understand when it's a warning, a tropical storm warning, what exactly could we expect?
Okay. I will start with a tropical storm watch.
Okay.
This is normally issued 48 hours before the system affects us.
Right.
So we would go for a warning when the system is a little distance from us. This time around, we didn't do the warning, the watch. Sorry. Mm-hmm. We just went into a warning because of the difficulty in forecasting Gonzalo because of its size. Had we done the watch, it would have been issued at 6 p.m. last night.
Right.
And around that time, most organizations would not be in operation.
Right.
To take effect of put things in place.
Mm-hmm.
So what happened is we spoke to the National Hurricane Center, and they issued a warning this morning. So persons were able to get that information as they wake up and hopefully get things in place.
Right.
So with the warning, we expecting conditions, tropical storm conditions in the next 36 hours.
Right.
So that's the difference between the warning and the watch. It's 48 and 36 hours. Yeah. So most times, the tropical storms, the wind speeds is what determines whether it's a depression, storm, or hurricane.
Right.
So right now, Gonzalo is at 60 miles per hour. And if it goes up to 75, that would be a hurricane.
Okay.
So we're expecting tropical storm force winds and then also associated rainfall.
Okay, and briefly, one of the problems I could foresee we having is, to date, we have been fortunate, and I must say thanks that we have been fortunate in that regards, and persons feeling that relaxed kind of effort to be saying, nous bénis Saint Lucia, y'a pas qu'à arriver, nous speak to that, and of course preparations as it relates to being prepared, even if Gonzalo might not hit us, but speak to the tendency of people telling us, nous bénis, et quand y'a pas qu'à arriver, nous, and you know,
complacency.
Yeah, being that complacent about it. Speak to that a little, and preparation.
That is one of my pet peeves, is that persons have this cultural notion.
True.
And this is something that a Met officer can't really change.
Right.
But then we keep asking persons, this hurricane season happens every year.
Yeah.
You have 6 months out of the year, and persons should, by now, after having seen what happened in Dominica and Bahamas,
True.
that we should put things in place, have our hurricane preparation kit, and do all the necessary procedures that NEMO asks us to do. Right. So we're working in partnership with NEMO, and then we're hoping that persons would get the message to prepare early, get your supplies, don't go rushing out now.
Right.
Yeah. So it's a culture change that we're trying to put in place. And actually, COVID showed us that we can do it.
Right.
After putting us on curfew, persons actually adhered to those directions. So I'm hoping that this is like a new normal where we could plan and prepare so that we would have less casualties and damage to infrastructure.
Okay, and finally, before I hand you back over to Jesse, has COVID, as you speak of it, did COVID change your motion of operation or anything to that regards as it relates to the Met Office and your duties?
Yes. Well, as you know, the Met Office operates 24/7.
Right.
We are there every hour. During the curfew, we had to curtail our operations.
Right.
Down to an 8-hour shift.
Okay.
But because of the hurricane season, we had to ask persons, to come out and do their duty.
Okay.
So we are on the airport, and we are at high risk.
Right.
Yeah.
Okay. Yes.
Okay, thanks for that. Finally, on my end, the pre-strike meeting, could you give us any insight as to that?
I'm actually awaiting word from NEMO as to when that will take place.
Okay. Hopefully we get some word from NEMO as well as to the information on the pre-strike meeting. Mr. Andre Joyeux, it's always a pleasure speaking to you, getting an update on our weather systems.
Thank you.
Cheers.
Okay.
Word there from Mr. Andre Joyeux, the director of the Saint Lucia Meteorological Services, speaking to us on Tropical Storm Gonzalo. And we are under tropical storm warning here in Saint Lucia, and as at 8 a.m. individuals are asked to please take care, take precaution, prepare for the hit of tropical storm Gonzalo.
Just one this vite, nous parler là by Monsieur Joyeux office Meteorology et puis là
just the Met office.
Met office là et puis là yon un petit bagay là il dit nous c'est nous là qu'a espérer un mauvais temps mais c'est un avertissement. Avec différence là dit un avertissement et puis yon hurricane c'est qui quantité vent mauvais temps ni avec ça nous ka ouais il est 60 liés par du temps et puis qu'a dit si monter pour 75 nous kaiwe il tourner en hurricane. Ça qui bien important il dit à moun ni pour payer attention pas quoi parce que si pas passer ici à nous béni dit nous attendre c'est un bagay nous attendre constant rien pas kay river nous mais ka quoi nous kay prendre exemple les vini pour ça qui t'est passé la Dominique Bahamas là nous kay changer de ces place à un mauvais temps il fait un chai dommage là quoi il a dit moun supposé toujours changer ou ni pour préparer payer attention pour avertissement qui ka bay qu'on pour à présent yo nous en bas en mauvais temps mais c'est avertissement si continuer manière ka les bon samedi nous ka nous ka à près 2 pouces glo là venu pour la pluie quoi souple Saint Lucia ça pas veut dire si rien pas fait date qui c'est chanceux nous chanceux mais toujours ni pour changer tous les années nous ka ni mauvais temps qu'a passé avec nous ni pour préparer quoi nous parce que là pas préparer qu'a trouver quoi dans position qu'a dit ça a pas un dos et ben pas ça pas ni ça il plie mais c'est pour nous préparer oreilles pas qu'à rouper tête merci tellement.
Thanks for that, Carlton. And on that note, we take a break. When we come back, we have a special presentation to be made this morning. That's coming from the Institute of Chartered Accountants to the NCF. And of course, the telethon pledges. People are still honoring the telethon pledges up to daylight today. You know, it's coming in better late than never, and we really do appreciate all of the cash kind, every effort and show of support that is made by entities here on island. Thank you so much again to the Institute of Chartered Accountants in advance of the presentation. So we're still waiting on Dr. Michelle Francois. She's supposed to call in, the national epidemiologist. We have registered a 24th case of COVID-19 here in Saint Lucia. And also a Saint Lucian tested positive for coronavirus after traveling to St. Vincent and the Grenadines. And so there is a probe ongoing to find out if indeed this person had a coronavirus while in St. Lucia. And so we hope to hear from her to give us an update on that situation. Until such time, we go to a break. When we come back, special presentation coming from the Institute of Chartered Accountants.
Do you have a question for a government minister or ministry? Here's your chance to ask anything. Send in your questions as videos or text to askmeanythingntn@gmail.com, and we will have your questions answered live on NTN Channel 122. Follow us on Facebook and YouTube for more updates and your chance to ask anything.
Better yet, use soap and water.
We must protect each other if we are to beat this corona.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging her up. No.
Advice is you to please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Saint Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
She's been watching, waiting, wondering when the sands of time will give way to a tide of change, and for yesterday and today to become a new tomorrow. For a time when her sun can kiss the cheeks of your loved one and her stars can twinkle in her honeymoon skies. When her earthly embrace will reassure and calm your soul. And her unique view can change your whole perspective. Proudly, she has risen to meet new challenges and to provide safe harbor to all who reach her shores. For her hopes and dreams still stand, shoulder to shoulder, a precious reminder of experiences yet to come. So, wherever your moments and memories take you, let her sense of adventure set you free. She is Saint Lucia. Let her inspire you.
Thank you so much for staying tuned. At this juncture, we have a special presentation being made to the NCF, follow-up on the telethon, a pledge being made back in April. We do have the Institute of Chartered Accountants in studio to make this special presentation. President of the Institute is Miss Andrea St. Rose. A special good morning to you. I hand over to you.
The Saint Lucia branch of the Institute of Chartered Accountants of the Eastern Caribbean wishes to thank all the accounting firms that answered the call when a request was made for a contribution towards the procurement of PPE for our frontline workers here in Saint Lucia in the fight against the transmission of COVID-19. As a result of the contributions, we were able to raise $15,000. The firms that have made this contribution possible are PricewaterhouseCoopers, KPMG, Ernst & Young, BDO, and Grant Thornton. We wish to take this opportunity to thank our frontline workers who put their lives at risk on a daily basis in an effort to keep us safe. We would like to remind all St. Lucians that we are not out of the woods and urge everyone to follow the protocols established by the government of St. Lucia towards reducing the transmission of the virus. On a daily basis, we see blatant disregard for the protocols that have been established, including the wearing of masks when in public spaces and social distancing. I am very pleased to present this check of $15,000 to the NCF on behalf of the accounting firms operating here in St. Lucia, and trust that it will go some way in assisting with the procurement of PPE for our frontline workers. And to you, sir, I'd like to present this check on behalf of the accounting firms here in St. Lucia and the Institute of Chartered Accountants of the Eastern Caribbean.
On behalf of the National Telethon, I'd like to say thank you to you and the organizations for such a generous contribution. I know it will go a long way to our frontliners, and we'd like to say thank you to our frontliners for their continued hard work.
Thank you very much. Ms. St. Rose, any final words?
I wish to take this opportunity on behalf of the Institute of Chartered Accountants as well to call on all St. Lucians as we go through this difficult time, including the stakeholders, the trade unions, as they deal with employers so that we can reach amicable solution in terms of the arrangements that are in place for employees. Too often, demands are made on employers that make it almost impossible to continue with employment. So I think that the provisions of the Labor Act should be considered in terms of taking all means possible to avert having to take redundancy actions. So with that in mind, I'd like to wish everyone a safe weekend with respect to the upcoming storm, tropical storm.
Thank you very much, Ms. St. Rose, President of the Institute of Chartered Accountants, and Mr. Rondell Shari accepting on behalf of the National Telephone from the Tourism Authority. $15,000 coming from the accounting fraternity here in St. Lucia. We definitely do appreciate, and Ms. St. Rose, if you could convey our appreciation on behalf of the government and people of St. Lucia for this donation. Thank you so very much. And we definitely also appreciate your advocacy there at the tail end of your presentation. We will keep that in mind. So stay tuned. When we come back, we do hope we can get Dr. Michelle Francois on the line. She is the national epidemiologist. St. Lucia has recorded the 24th case here on island. And also we have a case of St. Lucian traveling to St. Vincent and the Grenadines contracting COVID-19. So we want to get a bit of information on the contact tracing efforts that have been underway. So stay tuned for that and more coming up after this break.
In a world where germs are widespread, comes a group of superhero germ busters, the germaphores.
We spend most of our time fighting germs, every day of the week. After I play, I wash my hands. Before I eat,
and the photo,
I wash my hands. After I play with my puppy, I wash my hands.
Don't look at the photo now.
I cover my sneezes with my forearm or elbow when I am in public.
Okay. I was saying you guys could have done the photo. You got the photo?
And I cover my cough to avoid spreading dangerous germs.
It is online.
We are the germaphores, germ-busting superheroes. You can be too. Always wash your hands and cover your sneeze and cough. Let's stop the spread of menacing germs.
We'll be back, germaphores, with more powerful germs.
And we will be waiting to prevent you from spreading.
Overnight, growing national
a cashless
unrest.
society, a digital cashless society, one world currency.
A vaccine
which has
for COVID-19.
Droplets COVID patients.
Macy's iconic flagship.
Virus Track the coronavirus. Everybody vaccinated. On the corona pandemic.
If I was in opposition to the lockdown.
An infected conspiracy theories.
About the coronavirus.
Bizarre claims.
The truth about the origin of COVID-19 hidden from the rest of the world. And the Chinese.
In this constantly changing environment, resulting in sensory overload, cut through the noise and tune in to the National Television Network, the official source of information, all facts.
We at war with a virus, ready to harm us. Panic is not the answer. We can win this together.
Often use hand sanitizer. Better yet, use soap and water.
We must protect each other if we are to beat this corona.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging are a no.
Advice give you the please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Saint Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
Thank you so much for staying tuned. We are now in our final segment of the NTN Morning Update. And as promised, we have on the line Dr. Michelle Francois. She is the National Epidemiologist. Good morning to you, Dr. Francois.
Hi, good morning.
Thank you so much for calling in. I just want to get an update from you. We have been telling the public, the viewership this morning of the latest case of COVID-19 here in Saint Lucia, the 24th case, as well as the investigation that was initiated by the Ministry of Health and Wellness to dealing with to finding out some more information on the St. Lucia national who traveled to St. Vincent and the Grenadines and tested positive for COVID there, and efforts to find out to what extent would this affect our own community. Did this person have COVID-19 here in St. Lucia? And can you just give us an update on that ongoing investigation?
Okay, so I will start with our last case confirmed in St. Lucia, which is our 24th case. The individual, we did receive results on the 22nd confirming that the individual was positive for COVID-19. This is a returning national who was placed in quarantine on arrival in St. Lucia. We did the necessary follow-ups, and she has since been transferred to an isolation facility where she is being monitored and treated accordingly based on any complaints that she may have. There was no contact with any individual because she was placed immediately in in quarantine. So the risk level was pretty low for the public. In terms of the case, which was diagnosed in St. Vincent and the Grenadines, the first thing we did was to contact this individual because with anything else, you don't go into battle unarmed. You have to get the facts and you have to understand the individual, find out her contacts, where the places she visited, the last time she would have been at work. So that would have needed to be done prior to us going in just to her workplace. We also needed to speak with the family because the family needed to be informed, and we needed to assess the level of risk because these more than likely were people who she would not have had a mask in their presence. So these were extremely high risk, and so we had to contact the family first, make preparations to have them tested, have them quarantined, and ensure that everything was in order then. In terms of the workplace, we did go in with a wide team consisting of environmental health because it's not just going in and getting clinical details, but there was a need to inspect the premises, ensure that everything was in order as per our protocols, ensure the seating arrangements, hand sanitizers. So all of these things had to be inspected. And we swabbed persons at the establishment. Persons were sent home to complete the rest of the quarantine period. We also had present persons from the Bureau of Health Education who communicated with them and answered questions that they may have and guided them in terms of what they needed to do to keep themselves and their families safe. We accommodated persons who would not have had the conditions at home for quarantine. So these individuals who said, listen, I don't have conditions at home, I have young persons or I have an older family member at home who I'm worried about, these individuals, arrangements were made for them to be placed in one of our quarantine facilities so that they would not be in that space that was not conducive to their quarantine. We are awaiting results. All the samples have gone down to the Ezra Long lab where they will be processed, and we are working with the lab to try to get results at the soonest. Meanwhile, that is not the end of the investigation. We continue. There may have been persons that she would have been in contact with as well. So we are following up on persons who outside of the office and outside of her family who may have been in contact with her to assess the level of risk of these individuals and to decide whether they fit high risk or close contacts and do the necessary to quarantine these individuals and test them as well.
So far, we've been hearing of returning nationals, the latest cases of COVID-19 diagnosis being returning nationals. If this is indeed an indication that we had a St. Lucian within the community who was existing with COVID-19, can you just speak to us about what implications it would have and speak to the significance of this turn of events, if in case that is what it would be?
Okay, so in terms of her source of infection, we are still investigating that because prior to this, she did not have a travel history. But we also would remember that the Ministry of Health has been saying for the longest while, we're not saying that we're COVID-free, is we do not have any active cases or reported cases at the time. And we did emphasize that with the opening of the borders, it would be likely that we would get imported cases. We have been monitoring our tourists as well as our returning nationals who we place either in a certified hotel quarantine facility, or we grant home quarantine to persons with certain conditions and once they fit the criteria. However, the issue is that we continue to have violations of quarantine, particularly in the community, and that is of concern to us, because these are individuals, a lot of them have come in from high-risk areas, and by not adhering to the quarantine protocols, it is likely that these individuals are interfacing with our public, and there is a possibility of spread within the community.
That is very unfortunate. Can you just speak to perhaps if this has had any, if this has inspired the health officials to perhaps be more stringent in the use of approving home quarantining? Because there are some reports of persons complaining preferential treatment. They feel like they're not being considered duly and justly for home quarantine. Can you speak to that and also reinforce the institutional quarantine being the gold standard?
Yes, definitely. So there are certain criteria that we look at in terms of home quarantine versus facility quarantine. And not the fact that you have a home suitable to you, just you, does not mean that you automatically qualify for home quarantine. It is one of the things that we take into consideration, but that does not guarantee you home quarantine, because, as I said, we are perfectly aware that persons claim they have a home to themselves. We send them home, and they violate the quarantine all the time. So we look for persons who have serious underlying conditions, persons with very young children who it would not be manageable to have, for example, a 6-month-old or an 8-month-old or even a toddler in a hotel room for 14 days. So we look at these persons who are unable to ambulate properly, persons who are post-surgery, who require some level of visits to the doctor, or not necessarily visits to their doctor, but persons who require some level of medical care, which we are not able to provide on a one-on-one basis at the facility. So we have to look at these cases. But the mere fact that you have a home to yourself does not automatically guarantee you home quarantine, because what we have to take into consideration as well is that persons on home quarantine need to be followed up. So you need the manpower to follow hundreds of persons every single day making these phone calls. So it is also a strain on the human resource capacity within the Ministry of Health to have everybody scattered all of Saint Lucia versus having them in a facility where they can be monitored for that period of time.
Okay. Carlton, I don't know if you have any questions.
Yes, I would just like to ask you, Dr. First, as it relates to Saint Lucia and our protocols, could you just remind the public as it relates to a revert back to any one of our phases? As it relates, what would it take to see that we're probably back on the curfew, we're probably back with zoning? What would it take now that we are in phase 5? What exactly would it take to take us back to phase 4 or 3?
Well, we look at and we continue to monitor a series of indicators. And by all means, when we're looking at the number of persons, if we have community spread, the number of persons in the community who we would have diagnosed would be one of the indicators. When we look at the persons coming in not adhering to home quarantine, when we look at our ICU beds and the number of cases that we may have. So we have several indicators, and of course community spread is one of the key things. So if we pick up community spread, significant community spread, that is definitely one of the indicators for us to revert, which is why we keep emphasizing the need for persons to adhere to the home quarantine, to adhere to protocols, to put in place the measures that the Ministry of Health have been communicating to them, ensure the wearing of masks, social distancing. We hear it all the time that Saint Lucia we do not have cases in Saint Lucia. So persons are no longer adhering to that. But the risk is there. We do have persons coming in and our borders are open. So now more than ever, we need to adhere to those protocols.
And finally, as it relates to Gonzalo, and we are speaking of a tropical storm watch for now, but we are in the hurricane season, and we heard of the training done with the shelters and persons who operate those shelters. Could you speak to the aspect of that training and why it was so necessary, if you can?
Well, the training was done, and it was quite necessary given COVID and the way it is spread, COVID-19. Having a shelter means that you're going to have individuals in close proximity, and it is necessary for persons at the shelter to understand infection prevention and control. How do we minimize transmission? What exactly it is we are looking for in terms of a COVID case? How do we sanitize and disinfect the area? And, of course, the chain of command. Who do we call when we suspect something, and how do we manage accordingly? So the protocols needed to be in place, not just for the shelter, but in the context of COVID-19, to ensure that we do not have any outbreaks within the shelters when we have persons coming in.
Oh, thank you so much, Dr. Francois. Noted, and wish you all the best.
Thank you very much.
Thank you, Dr. Francois. Do enjoy the rest of your day.
Welcome.
Bye-bye. That was Dr. Michel Francois, the National Epidemiologist, giving us an update on efforts so far to trace this latest case we've heard of, the diagnosis of a Saint Lucia national COVID-19 in St. Vincent and the Grenadines, and the officials want to find out, if this individual did have COVID-19 while on island, while interacting with persons in their community, at their workplace, at their home, and so that is ongoing at the moment. And also giving us an update on the latest case of the 24th case of COVID-19 being recorded, diagnosed here on island. And
just to add, Jesse, I think it's noted that we should address the issue of persons saying we have no COVID, no panic COVID this year. Because a person panic COVID this year, and ironically, the same persons we heard crying and saying, what is government doing to bring in our expats and repatriated persons? Now we are seeing an issue or problem with persons not adhering to protocol.
Exactly.
And of course, that's the same set of persons that say, gouvernement pas qu'à vouer pour un monde, Saint Lucia gouvernement pas concerné, qu'à présent comme monde nous ni plus problème et puis sous vle dit, monde pas qu'à attendre ou été caillou si yo ba ou liberté ça pour faire quarantine caillou 14 jours ou Saint Lucia à présent ou la caillou ou était là et nous ka wè pour qui ça mi si yon moun qui marche y aller là y aller en supermarket là il prend un minibus y a en ville n'importe côté à présent on est pour vier acheter soit on est parce que nous a dit les vini pour situation qui après 14 jours avant yo pièce sin. So I think the onus is on us, and one of the statements that has been made and said before was that we start with ourselves, the protocols, maintaining protocols, the social distancing, the mask in public, washing of hands, clothes and other articles when you are back at your house. Messieurs, nous ka combattre vermin toujours souple, messieurs, en nous payant attention pour protocole et puis gide. Et quand docteur François bien dit nous, ça pas vle di nous panique Covid. Nous ni moun qui a pris traitement pour Covid. Et après encore nous ouvert bon nous plus moun quand avec Saint Lucien, souple, sous connaître yon moun qui là et qui supposé être kaili pas peur ou apporter il a commencé puis à délai ou pas apporter avec ses grand-maman et ben c'est soit un monde qui malade qui vulnérable qui trouve quoi affecté par moun ça quoi on nous suivre protocole souple simplicité.
Thanks for that, Carlton. And on that note, we'd like to thank you so much for watching. We've gone beyond our time. We'd like to thank you again to viewers here on island and abroad watching and looking out for updates coming out of the government of St. Lucia, what is being done to protect the population here on island. My name is Jessie Leonce. On behalf of Carlton and the rest of the production team, Vibert, Roger, we'd like to thank you so much for tuning in. Stay tuned for more NTN programming. And of course, we will be going into the weekend as the officials continue to monitor Tropical Storm Gonzalo. So there will be a pre-strike meeting. Hopefully we get some word from Nemo on what should be happening during the weekend. And we will be taking you to the Nemo headquarters for that for that event, looking out for Tropical Storm Gonzalo. Sit tight. We very much hope that you have put all measures in place. If not, do so as soon as possible to secure your home, secure your household, your food, your dry foods, protecting your documents, doing whatever you need to do to protect yourself during this Atlantic hurricane season. One is upon us, Tropical Storm Gonzalo, and we heard from the director at the Met Office of the very active hurricane season that is upon us. So please take note. Please take note and monitor things as we go along. Goodbye for now, TGIF. Do enjoy the weekend as well as much as you can.